Good evening. I hereby call this February the 8th meeting of the Public Safety Committee to order. Due to the Safe at Home order, all committee members are participating virtually. For virtual meetings, committee members will be muted until asked to be heard. When there is a vote, it will be necessary to take a roll call vote. A committee member will be recognized and will raise their hand and will state their vote. Committee members are Vice Chair, Councilmember John Larson, Councilmember Kevin Mundy, and Councilmember Barbara Burke, along with myself. There are 4 items on the consent agenda. Consent agenda items are approved with one sweeping unanimous motion unless a member of this committee asks the item to be pulled for consideration. Members of the committee, half of the items were discussed in finance. Are there any items that should be pulled for consent for consideration? If not, I'd entertain a motion.
Entertain a motion for approval of the items on consent agenda.
Second.
Motion and properly second. All in favor of approval of the consent agenda, please say aye by we'll go
Aye.
to Councilmember Larson.
Aye.
Councilmember Burke.
Aye.
Councilmember Mundy.
Aye.
And it's an aye for myself, so that is approved unanimously. Madam Clerk, we'll move to item G1, please.
Item G1, alternative police response strategies.
Members of the committee, as you are aware, members from the Triad Abolition Project spoke with us last month, and we had a detailed conversation on the police co-response models and the alternative response models. What we want to do is continue that conversation, and with that being said, I'll turn this part of the presentation over to Ms. Tasha Logan Ford to begin the conversation.
Thank you, Chair Taylor, Mayor Pro Tem Adams, member of the committee and council. In the fall of 2020, a staff work group was established to begin looking at alternative types of response models. It included employees that were from the Office of Performance and Accountability, the Police Department, and also our Strategic Initiatives Administrator. We wanted to actually analyze calls that were coming into the department, get an idea of the types of calls our officers were responding to relative to behavioral and mental health. The initial focus of this work was, as I said, on analyzing the 911 calls that were coming in, and then also spending some time to research different response strategies. There were 3 main objectives that were part of this work that began in the fall, and it was for us to try and establish some data-driven understanding in terms of the workload around these types of calls and what the portfolio looked like. We also wanted to be able to utilize some research-informed assessments to determine whether or not there would be some more effective ways to respond to these calls based on what we're seeing in our community. And then the last piece of it was to actually determine which projects it would make sense for us to implement and have a period of time to really test the efficiency of those identified alternatives to determine if we needed to make any of those recommendations a permanent part of our model. There are several cities, 7 cities, and some other partners that are participating in this cohort. It includes Cary, Durham, Charlotte, Greensboro, Rock Hill, South Carolina, Winston-Salem, and also the Triangle J Council of Government. We also have partners that are involved in this work, RTI International, and I'll let Ms. Martin explain our partner from RTI that's on the call. And then also it included a partnership with the University of Chicago, which most people are familiar with from their work with the CAHOOTS model. In order for us to dive into this a little bit deeper than we were able to do at last month's committee meeting, I'll ask our Director of OPA, Mr. Scott Tesh, to provide a summary of the response models, and then he will be followed by Ms. Meredith Martin, who will discuss the components of the RTI project and the funding for this moving forward over the next year. Mr. Tesh?
Tesh, you have the floor, sir.
Good evening, Chairman Taylor, Mayor Pro Tem Adams, and members of the committee and council. Meredith, do we have that presentation? We're queuing it up. So, Chairman Taylor, as you discussed, we got into this briefly last month and talked about one of the slides in terms of CAHOOTS. And so we'll see that slide again. But the information that we're going to provide here is on alternative response models to just law enforcement for mental and behavioral health incidents. We're going to look at some research at a very high level on what some other communities throughout the nation are doing, and then hone in a little more closely on a couple here in North Carolina and what they've done recently. Some of our peer cities in the Big Five here in the state. So Meredith, if you want to go to that next slide. The research that we did when we talked about this last month too, there are really three types of calls or three types of responses to calls for service for mental and behavioral health. The first one, they're law enforcement only. So the police department, typically you have people who are responding who have crisis intervention training, CIT training. We have police officers in Winston-Salem that are CIT trained. We see in other organizations that they may actually have mental and behavioral health units or specialized CIT response units. And so that first bullet point is just the police are responding to these types of calls, but they're doing so with people who have training in this area. The second model there, the co-response model, which we started to talk about a little bit last month, is when a law enforcement officer and some sort of mental and behavioral health professional respond to a call at the same time. So you would get a police officer with a clinician of some kind. Sometimes that response happens literally in the same car. We see the clinician actually rides in the car with the police officer when they're dispatched to these. There were a couple of cases where we saw a clinician would be called separately onto the scene. So it can happen either way. And those can be internal resources or contracted. Some cities have elected to hire clinicians directly into the police department. The city of Greensboro, which we'll see on another slide, actually had a contract and has transitioned to doing this internally. And so those clinicians can either be city resources or they can be external via contract. The third bullet point there, the alternative response model, is what we're going to call that cahoots type model, is one where law enforcement doesn't respond to a call. So the call comes in through dispatch protocol and they only send mental and behavioral health or medical professional on site. And it doesn't mean that police can't obviously show up if they're needed, but the intent there is not to have a law enforcement response to certain types of calls. So Meredith, if you'll go to the next slide. These are several jurisdictions that we looked at. Eugene, Oregon, obviously with the cahoots model up there at the top, and these are kind of sorted by whether they have that alternative response or co-response model. The response without law enforcement is something that you're seeing more. And so we've got just a few cities on there that are doing it. There was actually a resident who reached out to Chairman Taylor and passed along to staff that Denver, Colorado, you see there on the list, in 2020 actually began piloting an alternative response model in certain areas of town at certain times, kind of modeled after the cahoots model in Eugene, Oregon. And so this list is just to show you that there are a lot of cities out there that are starting to do this, and some that have been doing it for a considerable amount of time. I'll note it says Los Angeles, California, 2020 for alternative response model, but they have had a co-response model since the early 90s. And so you see that as an iterative process. Some of these cities that have had co-response models are starting to look now at that alternative response without law enforcement. We do see here 3 cities in North Carolina: Greensboro, Raleigh, and Charlotte. And so we're going to dive a little bit deeper into those on the next slide. So I talked briefly about the city of Greensboro. They have internal staff now where they had a contract before. The staffing column that you see there, so Greensboro has 7 mental and behavioral health professionals on staff, along with 8 law enforcement officers that are dedicated to a unit for this co-response model. That final column says MBH funding. It's not the total cost of the program. That's supposed to be just the cost that was added to the budget for the mental and behavioral health professionals to start. So the city of Greensboro originally had a $500,000 contract for service, and they're now committed to spending $500,000 internally for those 7 clinicians that they're gonna hire in. The city of Raleigh, again, just started last year with a co-response model. They have 3 mental and behavioral health staffers. They did not add anything to their budget to do this. They reorganized current resources internally and created this unit. And so you see a no addition to the budget there. They did that without adding to the budget by just simply taking some other vacant positions and moving them around. Charlotte, as you see there, a contracted model. They contract for 6 mental and behavioral health professionals, again, with a number of law enforcement officers in that unit. Theirs is roughly $700,000. It's a multi-year contract and it's incremental each year. So the $700,000 is an approximate number. So we wanted to give you a feeling of what other cities in North Carolina were doing, how long they had been doing it. Here with Raleigh and Greensboro just moving into the space and what the cost was to add those. We will talk about Charlotte again here in just a second and some other things that they may be doing. They may be looking to move towards that alternative response model as well. Meredith, if you'll move to the next slide. So we brought this slide up last month, and I can go through it again here. We talked about the CAHOOTS model and what it is. And it's a response model where, again, law enforcement is not dispatched primarily on many of their types of calls that are related to mental and behavioral health issues. Two people show up in a van. One has healthcare training and the other has clinical training. You can see the performance data there for Eugene, Oregon. They were the sole responder to nearly 14,000 calls in 2019. The police department estimates that somewhere between 5 and 8% of their total calls are diverted away from a law enforcement response. We talked about that difference between 5 or 8% and 17% last month, as there are a significant number of calls that come in now. The program has been so successful that the police department believes there are people who call actually just to get a service that you otherwise wouldn't call 911 for. Again, in less than 1%, it's actually about 0.65% of their cases do they need to call for law enforcement support. So it's actually very rare that they have to, once they're dispatched and on scene, that they need backup from police. The program expenditures and savings numbers are ones that come from the Whitebird Clinic, who is the contractor that provides the CAHOOTS program. And we talked about these. It's roughly $2.1 million across 2 cities. So it's Eugene, Oregon, and then also, I believe it's Springfield, Oregon. And they do a little bit in Lane County outside of the city limits as well. And the $8.5 million there, they take a cost per call and multiply it by the number of calls that they respond to, and that's how they come up with the estimated law enforcement savings. I will tell you the contract with Eugene, Oregon to provide the service is roughly $1.2 million a year right now. For that, they get 24/7 access to one van, and then there's another 12 or 13 hours a day during peak times when there's a second response unit. So they have one response unit all of the time and 2 response units for about half of the day. The sub bullet point down there, we didn't independently verify, the city staff didn't, the 2.1 million or the 8.5 million number in terms of expenditures and savings. Those are what are reported by the Whitebird Clinic. They are out there, widely reported, and so we are including those. But again, I don't want to, would not be, couldn't say that we could implement this anytime soon and see, $6 million in savings or something like that to the budget immediately. Meredith, if you'll go to that next slide. In the research that we did, and this is getting a little bit away from the mental and behavioral health calls, but I thought it was important to note, there are a couple of cities that are looking at what they're terming civilian responses. So outside of mental and behavioral health calls, there are other types of calls that also may not need a law enforcement response. And just noted 2 of them here. Oakland, California, City Council was looking at ways they could do this. And most recently, there was an article in Governing Magazine where this came up in the city of Charlotte at one of their board meetings, I believe in November. And you see the types of calls there. So non-urgent call types being noise complaints, abandoned cars, property damage, some of those minor infractions where they might be looking at ways to not send a law enforcement response to those either. I couldn't find any literature, and I don't think there's a lot out there in terms of the civilian response, but it's something that's kind of out there on the periphery and something that with our engagement with RTI, as we're looking into the data that we have, something that we could look at. Just wanted to mention it was out there as a segue into what Meredith is going to present with Mr. Agard. So, Meredith. Are there any questions on that piece of it before we get to the 911 calls for service project itself? I know there were a significant number last month, and so if I can answer them, I will.
Any questions for Mr. Tesh at this time? Councilman Larson. You may have to unmute, sir.
Can I assume that the Charlotte list of complaints, that noise complaint, abandoned cars, illegal parking, et cetera, property damage, those are potential, or are those actually implemented now in Charlotte as part of their program?
Those are potential. Those are things that came up in a council meeting, ones that they would like to look at. They have not implemented anything yet. I think police department is still in the infancy of researching what types of calls they would actually do that for.
Yeah, I'd be very interested in how that's implemented. Yeah. Thank
Any
you.
other questions for Mr. Tesh?
I do. Scipio.
Councilwoman Scipio.
I guess the thing that I'm most curious about, Mr. Tesh, is in Winston-Salem, how many of our 911 calls would qualify as an MVH call? And is that in part of your presentation?
So,
Councilmember Scipio, that is what we're trying to determine as part of the RTI process and how we're now doing an analysis of our calls. So we don't have that number for you right now, but that's what we're trying to drill down to, is to try to determine what is the actual need, and then how will we be able to meet that need and what type of resources would need to be available.
Okay, thank you. And I would love to know if we could verify how the police department saved $8.5 million by having this alternative measure that does cost money. I don't understand how they define the savings, because to have this co-response or the alternative, there are costs associated. So I would really try to understand how you do get a savings out of that.
Councilmember Scipio, I can put together something on the methodology for how that was calculated, but without contacting them directly, we're not going to be able to get into the nitty-gritty details. But as far as how they arrived at that calculation, we can get that to you.
Yeah. Thank you very much.
And before moving on, I did want to say one other thing too. We're going to have a gentleman from RTI. I did want to say the research that you have seen here came from city staff, not from RTI, just to note on that as well.
Councilman Mundy. Thank you, Mr. Tesh.
My question was much like Councilmember Scipio's, and I think the answer is you don't have it, but if we can in any way find out what that payback period is. After 2 years, do we start seeing an increase in revenue or savings rather? I don't know if there's any way to dig down, but that has such a huge budget impact. I think we would need to know that.
I'd be more than happy to look at, if we get direction on a specific model, to go in what a multi-year forecast would look like for expenditures and potential cost reductions out of that.
Thank you.
Councilman Larson.
I'm very excited about us exploring this mental health component of our police role. I am curious, though, and I think maybe it can be answered tonight, is the relationship that we would have as a city to our mental health programs that the county runs. And typically, the matters of public health fall under the county purview. And if we're looking at setting up some sort of parallel program, how that's going to work within the general structure of, there's an article in today's paper, I think, about public health, mental health programs within the county itself, and looking at how those are handled. So as we explore this, I'd like a little clear understanding of our relationship with the county and its role in public health programming.
All right, members of the committee, we'll move forward with the 911 calls for service project. I just want to let you know we have 3 professionals that are waiting to speak to us about these matters. So we will get them called up as soon as we get through the presentation. So Mr. Tesh, you have the floor to move forward, please.
I believe Ms. Martin is going to be moving forward with the next part of this presentation.
Martin.
Good evening, Chair Taylor, Mayor Pro Tem Adams, members of the committee and council. I'm going to go into a little bit more detail about the 911 calls for service project. The project is a partnership that, as Ms. Logan-Ford stated, began in August of 2020. The purpose of the project is to complete an analysis that evaluates if community resources align with community needs based on the types of call for service received by our 911 center. From the analysis, we plan to develop recommendations to improve responses by law enforcement and other first responder agencies. So the project has 3 goals to achieve within an 18-month period. First, we want to gain a better understanding of community needs based on the calls for service analysis. This work will be completed through a data-driven approach. Secondly, we will identify alternative response strategies that fit the needs of our community and align with our resources. Lastly, we will support the implementation and evaluation of the alternative strategies. So as mentioned, this is a partnership between 6 cities within North and South Carolina, the Triangle J Council of Governments, RTI International, and Arnold Ventures. Mr. Brian Agard from RTI is joining us tonight to discuss the partnership and approach to the project. I'll hand it over to Mr. Agard.
Mr. Agard, you got the floor, sir.
Thank you, Chair Taylor, and thank you for all the other committee members. So if we could advance to the next slide. So I think, first of all, Mr. Tesh and Ms. Martin have done a fantastic job tonight framing what we're trying to do here. And what RTI is offering the cities in the cohort is we are a nonprofit, nonpartisan research entity that can provide independent analysis of the call for service data in your city. So that's the phase that we're working through now, concurrent with phase 2. We have 3 years of 911 call for service data in Winston-Salem, and we're going through the process of analyzing that to understand just how prevalent some of these issues are. And I think the observation about how many calls are related to a subset of mental health is spot on. So to support this effort, we're doing a few things. So we're analyzing the 911 call data. We're proposing alternative ways to make sure that we're capturing the information necessary within computer-aided dispatch where the call for service data is housed to make sure we're being sensitive to the breadth of the issue of mental health being related to calls in these various cities. And in addition to that, we've been working similar to what Mr. Tesh has been working on, is summarizing the literature and practice around alternative strategies. We'll be presenting that information to the cohort in the 19th of February. In addition to that, we have a series of technical overviews that can be shared with you all that can serve as a menu to understand what the various possibilities are in terms of alternative responses. And as Ms. Martin noted, what the resources are required for that. So to make sure that we're inventorying the resources that are required to do some of these alternative responses, I'll use the Cahoots alternative strategy as an example. In Eugene, Oregon, there's a plethora of community-based and public resources that folks can be referred to. And it's been cautioned that in replicating the Cahoots model, if you don't have those types of entities to refer folks to, you can still have the Cahoots response in the meeting the acute needs, but it would be difficult to replicate that fully. In addition to I wanted to mention specific to Cahoots, in terms of how they're calculating the cost savings, they're estimating the amount of proportion of calls that the police are no longer responding to, calculating the amount of time spent on that, and suggesting that 4 officers on scene for that time, they would take the rate of pay for those officers and scale it up, which is how they get to that number. That's something, Mr. Tesh, if you would like, we can work through with you. We have contacted them and we understand how they're calculating that. And I think it's a good observation because the dollars and cents of this are obviously critically important as you consider budgeting. And so for phases 3 and 4, really RTI's bread and butter is project evaluation. So we would help implement these pilot projects, and as they're being implemented, we would make sure the process in which they're being implemented has high fidelity to the whatever you're replicating. And then finally, we want to see if this works. So we would determine what outcomes are of interest, what are the things that the city wants to see by implementing these alternative strategies, and then we would measure that through rigorous project evaluation design. And I'll just mention that this work, the support from RTI is being funded by a philanthropic entity, Arnold Ventures, and this is coming at no cost to the city of Winston-Salem.
All right, that's great news. Thank you for taking the time to make the presentation, Mr. Agard. Members of the committee, are there any direct questions to Mr. Agard before we get into our speakers? I saw Councilwoman Scipio's hand.
I'm not sure if your speakers might answer this, but I know that many of the larger cities have severe homeless populations that create lots of challenges. I'm very familiar with San Francisco and Oakland. I'm there regularly, and I've just seen that population. And so in your plan, do you look at other social conditions that might be triggering the need for this mental health intervention, and what may exist in one city may not exist in our city to the same extent, but maybe we can start getting prepared and be more proactive in that case. So the question is, are we be looking at all of the different dynamics in the communities that may have triggered this alternative response in other cities?
Yeah, it's a wonderful observation. And so I'll say a couple things. First, I think we would hope that any changes in that based on community need being driven by some root causes like homelessness, we would hope that that would be reflected in the call for service data to make sure that we're being sensitive to that. But if we're not, there's a couple other things that we're doing. In the process of inventorying the resources, there is a survey component to identify for resource providers now, what are the types of needs that they're seeing most acutely and where are the gaps in resources to address it. Additionally, in other cohort cities, we have fielded focus groups with first responders to understand what sorts of challenges that they're facing on the front lines to make sure we're getting an accurate and comprehensive picture of the issue in these jurisdictions.
Any other questions for Mr. Agard? Councilman Mundy.
Yes, and I'm not sure who is in a best position to answer this, but do any of these models where there is a call with the law enforcement officer in conjunction with a mental health specialist, are any of these plainclothes officers? Because one of the concerns that's been expressed by our community citizens groups is that just the presence of a police officer in uniform can escalate a situation rather than de-escalate it. So I want to know if there are any models that kind of provide a hybrid of that.
Councilmember Mundy, we can look into that for you. I spoke directly with someone in Charlotte Mecklenburg Police, and I can tell you that in their co-response, they were wearing, and I don't know the name for it, but they were wearing civilian type clothes. So they have, I think the kind of more the tactical pants and a polo kind of thing rather than the actual uniform. But I did not research that in terms of the response models for the other cities. We can go back out and see specifically in Greensboro and Raleigh here in North Carolina how they're doing it as well.
Thank you. I think it's worth investigating. I appreciate that.
Thank you. So what I want to do at this time is get two other citizens involved in the conversation. We have with us Celine Johnson, who is a board certified behavior analyst. And we also have Dr. Jillian Neal, who is a North Carolina licensed health service psychologist. We'll start with Celine Johnson. If you give your name and address for the record and make your comments, please.
Thank you. Yes, I am Celine Johnson. My address is 2350 Queen Street. I am a board certified behavior analyst. I wanted to share that in my 28 years of experience working in the field of intellectual and developmental disabilities and mental health, I have never carried nor needed a weapon, a taser, pepper spray, or handcuffs, despite the fact that I have supported hundreds of people, including young adults in behavioral crisis. Only once in my career did I need to call law enforcement for support because I was fearful that a young man in our care was in danger of running into the street. Thankfully, that particular police response did not result in tragedy, but the risk was certainly there. Conservative estimates suggest that at least 25% of all fatal law enforcement encounters involve people with mental illness or disabilities. Why are people with mental illness and disabilities at increased risk for these fatal encounters? Well, when a police officer interacts with an individual, she or he expects compliance and cooperation. However, a person with a mental disability may not be able to comply. This is often mistaken as a malicious choice to resist, when in fact the person may lack understanding or even physical control. When a person with a disability is a suspect, she may not understand the instructions, may be overwhelmed, or may even run if she fears she's being detained. The presence of law enforcement can further exacerbate or escalate the situation, especially for Black and Brown people who deal with chronic and persistent mental health issues as a result of generations of trauma and systemic oppression. Professionals who are fully trained in mental health crisis have been shown to have the opposite effect: calming, de-escalating, and redirecting. And with respect to Mr. Mundy's comment, regardless of what uniform you're wearing or plainclothes you're wearing, your training and demeanor are what ultimately create the feeling or the circumstance that creates that escalation. As Mr. Test mentioned, cities across the U.S. are utilizing funds from police budgets to implement alternative response programs for nonviolent and non-criminal needs. And I know Denver was on your list of co-responder models, but actually just this week, they published 6 months of data where they are piloting an alternative response similar to Cahoots. And while I may be oversimplifying the formula for cost savings, the basic tenet is that if we have other professionals responding to nonviolent and non-criminal calls, the costs are less. We need fewer law enforcement officers. We need fewer police cars. I understand budgeting is a very practical matter, but the lives of our citizens is paramount. These programs capitalize on the brand recognition of 911 to redirect calls to more appropriately trained responders, such as mental health professionals. In addition to keeping people safer, they do save money. Further, the Substance Abuse and Mental Health Services Administration, a part of the U.S. Department of Health and Human Services, specifically recommends responding to mental health and substance abuse calls without law enforcement accompaniment unless special circumstances warrant. We call ourselves the City of Arts and Innovation, so our practices need to be innovative. 33% of our city's budget is for policing, when law enforcement is not always the optimal responder. We have the opportunity to introduce a truly transformative program that will save lives, especially those of Black, brown, disabled, mentally ill, homeless, and other marginalized groups who are at heightened risk. To be innovative, we can't collect and analyze data for 18 months while we run the very real risk of a tragedy in our city. Our vulnerable citizens desperately need mental health crisis response integrated with our 911 system. And unless I'm misunderstood, it does concern me that the suggested service project is working with cities that all use a co-responder model and none that use the alternative response model. For these reasons, my colleague, Dr. Neal, who will speak after me, and I are recommending a short period for collection and/or analysis of baseline data, followed by working to begin a pilot program through our 911 system that includes or utilizes an alternative response model or a layered response model. And that is what Denver is doing, a layered response, where they are using a co-responder model for some calls and an alternative response model for other calls, depending on the appropriateness of what's appropriate in the situation. So it's for those reasons that we're making this recommendation. I thank you for your time. I'm happy to take questions, but I know my colleague, Dr. Neal, also has some comments. Thank you.
Okay, thank you, Ms. Johnson. Are there any questions for Ms. Johnson before we move to Dr. Neal? All right, Dr. Neal, you have the floor. If you give your name and address for the record, please.
Gladly. Good evening, and thank you very much for your time. My name is Jillian Neal, and I live at 2029 Williamsburg Manor Court, 27103. I am coming before you today as a licensed psychologist and also a citizen of Winston-Salem to encourage the adoption of a responder model that diverts from police as many calls as possible, recognizing that there may be instances where a police response is necessary. And why would we make this argument? I think that you've heard several arguments in favor this evening already. I would point out, just as my colleague Celine did, that both SAMHSA, which is a Substance Abuse and Mental Health Administration, which is a division of the Department of Health, U.S. Department of Health and Human Services, recommends best practices to not involve police, once again, unless they are needed in a situation. And data from other cities have shown that pretty much 80 to 90% of these calls, maybe even more, if you look at the Cahoots data, for example, don't require a law enforcement response. A majority of the time, the calls are informational in nature, which means an officer might come out and tell somebody what's going on and then leave. And so for one thing, it's a question of resources, and can the resources be better used? I don't think that's the most important thing here, but I know resource allocation is a really important piece of this puzzle. And I would also suggest that those who are looking into the models more closely look at the NAMI and the SAMHSA guidelines. So I can share with you, for example, as we were talking about cost and cost savings, which once again I can understand is incredibly important and important to the city, that there's a few things at play there from what I can understand. I am not a business person, but from what I can understand is For one thing, there's lots of grant funding available for these projects right now through different organizations like the Bureau of Justice Assistance. Other sources of funding tend to be, sources of cost savings tend to be, one, people can get connected with services, which then diverts the cost of repeated calls. So if you have folks who are needing to use that system over and over again, and there has to be a law enforcement response every time, then really being able to get them connected with a service that can actually provide that longer term support, that care, that mental health care that will hopefully keep this person safer and off of the police radar, so to speak, in terms of helping them to actually connect with the support or help that they might need instead of it always being a crisis. And so that's part of the issue, and that when police are not involved in mental health response, there tends to be a less likely chance of involuntary commitment or commitment to the hospital generally. So crisis counselors, folks in mental health professionals are more well equipped to help keep people out of the hospital because it's what we try to do as much as possible. And so allowing them to step in those moments can also be a cost savings in terms of the city, county, whomever not having to absorb the cost of that. And I would also highlight, as I say that, police want to be police, and I doubt very much that many of them went into the field wanting to be mental health professionals, which is not a dig on them. I didn't become a psychologist because I wanted to be a police officer. I chose my profession to do my job. And while the data on this seem to be very sparse, anecdotally from what I've been able to read and see from law enforcement officers, they don't want to be mental health professionals, and they want to be able to be public safety professionals and community members that are there to do what they're meant to do. And so allowing them to do their job, allowing mental health professionals to do our job, and working collaboratively is great, but that doesn't necessarily mean embracing a co-responder model. People with mental illness are very, very rarely violent. We have some terrible stereotypes about that, but the truth is that they're 10 times more likely to be the victims of violent crime than the perpetrators of violent crime. They're much more likely, I've seen something on the order of 16%, 16 times, not percent, more likely to be killed in an encounter with a police officer than a person who doesn't have a mental illness. And I think that these are among our most vulnerable citizens, and that we have a real that we are obligated as human beings, as professionals, as those who are charged with the care of our city, to really think about what's going to be the best for them and what's going to be the best for our city. And so allowing the police to do their jobs, allowing mental health professionals to do theirs, and allowing people to get connected with resources before they ever get involved with the criminal justice system, because that's the other piece. NAMI highlights in their best practices around this that even the presence of police can be very agitating to people, particularly, we have Black and brown folks and Black and brown communities that are concerned about the presence of police in their communities. And so if you look at what they refer to as, the sequential intercept model, which is it's diversion models all along the way for people who may have mental illness and encounter the criminal justice system. There's a place called Intercept Zero, and we want to stop people at Intercept Zero, which is before the police are even involved in the first place, and get them access to services without having to have any contact with the justice system, without having to have a record, without having to have someone show up in a police car and potentially have to enact certain protocols that are part of being in law enforcement that a mental health professional wouldn't use. And so, NAMI cites, that law enforcement policy can sometimes override mental health best practice because they're just such different fields. And, of course, they've got their head on a swivel, always looking for the threat because that's how they're trained. Whereas de-escalation is a big part of what we do in crisis response. I know that my time is limited here, but So I'll wrap up there, but I just really, really would like to encourage the city to look into these options and to think about how we can best care for these citizens, because the data are strong from lots of places across the U.S. I know Houston has a diversion model as well. Broome County, New York is another great example to look into. So I'll wrap up there, but thank you for your time.
No, let me say thank you for your time. Ms. Johnson, Dr. Neal, thank you for adding value to the conversation. As I always say, your words haven't fallen on deaf ears. We do have a plan through the 911 Service Recall Project to collect data and to allow staff the appropriate time to make the recommendations on the response models that we should adopt to do just what we're discussing here today. What I'd like to do is we have 2 other items on the agenda. Mayor Pro Tem Adams is recognized.
Yes, thank you, Chair Taylor. Councilmember Taylor, if you remember a decade ago, we were going to come in and reduce the number of police calls because our police show up at every 911 call, and the fire department shows up when the emergency management people for the county should be there. And I would be interested to know if there is any data anywhere, I think it is, for other cities right now, the breakdown of the 911 calls that we can verify, even in Winston, that are calls that are sequentially for fire, calls that are for an ambulance / EMT, and calls for actual police calls. That's all I have.
And we will be working with our police departments, our fire departments, and our emergency management departments to make sure that we're being inclusive of not only their voices, but the voices of the community. So this is a collaborative effort. Great comments. Councilwoman Burke.
Thank you so much, Chair Taylor. I just wanted to make a statement. I do not have a question. I want to make a statement in support of the alternative response model. And I want us to notice that from the research from other cities, more cities are turning to the alternative response model. Even those cities that started out with the co-response model, they are moving toward the alternative response model. I also want to say that I really do like hearing, and I think this is going along with what Mayor Pro Tem Adams just mentioned, the community needs assessment being part of the phases, that the phased approach. We're going to have 4 phased approaches, and that is one of the approaches that we're going to take. The needs in Winston-Salem will not be the same as the needs in another city. So we need to find out what our needs are. We need to find out what kinds of calls that are non-law related in Winston-Salem, and how can we best address those calls. I also want to say, unfortunately, that there have been repeated instances throughout our country where law enforcement officers have been called, and it has not been for a law enforcement situation, and it has been with individuals who have mental health issues, and things have not ended well. A lot of times these situations have ended with fatalities, and this is what we don't want. We want to make sure that we provide for our residents the resources that they need. And it's not always going to be law enforcement. And if we don't need to connect our residents with being part of the justice system, this is a great opportunity to not do that. So I really do like the alternative response approach. And thank you for giving me the time to say that.
Thank you, Councilwoman Burke. Councilman Mundy, excuse me.
That's hard to say. I would just like to echo really what Councilmember Burke said. Since the last time we met, I've read a good bit of information that Ms. Johnson and her group shared with me. I've also spoken with the Mental Health Association, some folks there on some other projects that I'm working with. I'm starting to lean heavily towards the alternative approach as well. I think that if the calls will confirm that we would be better off going in that direction. And I also want to say that 18 months is too long to wait to make any decision. So whatever we can do to shorten that time frame would be great.
Well, I can say that this has been excellent dialogue. It sounds like we're moving towards progress. Mr. Agar, we're looking forward to your work with our RTI. We appreciate the partnership, and we thank everyone for being collaborative in order to get this initiative off the ground and moving forward. With that being said, we will move forward to item G2, but we haven't forgotten about item G1. We will revisit this and do what we need to do to get this done. Madam Clerk, if you read item G2, please.
Item G2, 2020 Successful Outcomes After Release Program Report.
All right, members of the committee and council, most of you are familiar with SOAR. It is a two-part program. One part provides job opportunities for formerly justice-involved individuals. The other part works to provide resources to nonprofits and community organizations that are doing the work. To talk a little bit about the program, I want to start off with Mr. Johnny Taylor, who's the Director of Operations. Mr. Taylor, you have the floor, sir.
Good evening, Chairman Taylor, Mayor Pro Tem Adams, other members of the committee and council. Tonight, staff will bring a report on the 2020 SOAR program. There will be a general overview of the program, some historical data outcomes, and also information about new initiatives and a budget analysis. It would cost to expand the program from 8 to 16 individuals. Tonight, I'm going to ask that Ms. Faith Bartlett would provide the presentation, but I also want to recognize Mr. Troy Sneed, who is the other member of the staff, and they have done a marvelous job with this program, especially considering the restrictions created by the pandemic. So at this time, I will turn this presentation over to Ms. Bartlett.
Thank you, Mr. Taylor. Ms. Bartlett, you have the floor, ma'am.
Good evening, Chairman Taylor, Mayor Pro Tem Adams, members of the committee and council. My name is Faith Bartlett, and I'm the project supervisor of the SOAR program. As Mr. Taylor mentioned, I'm here today to present the 2020 SOAR program report. SOAR stands for Successful Outcomes After Release. The mayor and city council approved funding for the program in 2014-2015. It is a 6-month program that provides life skills, work placement, and mentors to former offenders re-entering the workforce while supplementing the city's existing workforce in areas of critical need. Participants work a maximum of 32 hours per week while earning the city's minimum wage. Next slide, please. This bar chart represents funding sources for the work experience and grantee agencies. According to this chart, the work experience program has been allocated with a stable $150,000 over the last 4 years. Next slide, please. Recently, there has been community interest in expanding the program. This current slide demonstrates the cost analysis of increasing the program from 8 to 16 participants. Next slide, please. This pie chart indicates the success of the program. Since 2015, the SOAR program has enrolled 63 participants and has graduated 49. 21 of these participants were directly hired within the city, while 4 continued on with the city through Winston Personnel Group. 12 participants were hired outside of the city, while 1 pursued post-secondary education. 14 participants did not complete the program. Next slide, please. In order to grow, SOAR's newest initiative is a partnership with the Office of Sustainability and Keep Winston-Salem Beautiful. SOAR participants use blue bags to retrieve litter at 20 of the high litter areas. Next slide, please. The team averaged a collection of 57 bags of litter per week for a total of 1,480 blue bags. The blue bag program successfully provided a visible impact and allowed the participants the opportunity to give back to the community. This program was featured on Fox 8 and Winston-Salem TV digital media. Next slide, please. Our most recent class started in July and ended in January. 8 participants were placed in various labor and clerical positions. At the end of the program, 1 participant was hired by the CityLink, and 2 continued on working at Fleet through Winston Personnel Group. Next slide, please. That concludes my report. I'm open to any questions. Thank you.
Members of the committee, are there any questions for Ms. Bartlett about the SOAR program? I know we brought this up for your understanding and consideration, but also we wanted to give some space for Triad Abolition Project to hear a little bit about the program, talk a little bit about our efforts to try to increase the program and its effectiveness. So any questions at this time? Councilwoman Scipio.
Yes. Ms. Faith, could you put that pie chart up? I can't get to it. I have only one computer in front of me. The one that has the 63 enrolled and 49 completed. Okay, thank you. So of the 49 who completed the program, 21 of them were hired by the city. Is that right?
Yes, ma'am.
Okay, so the number that talks about the status, I was just saying that we had 63, we have 14 that dropped out, correct?
Yes, ma'am, they did not complete the program.
They didn't complete it. Is there any particular reasons? Do we do exit interviews to sort of identify what may have happened?
It was for voluntary or involuntary reasons. So voluntary could be that they were hired they were hired or had a better opportunity, or involuntary would be due to conduct issues.
Ms. Scipio, if you can hear me, you probably muted.
Mute. Okay. I'm so sorry. I muted. There's a phone ringing in the background. My question about the blue bag program, were those participants doing that program as a volunteer activity, or were they being paid to do that, to pick up the trash?
They were assigned to the program. They were being paid.
They were. So, now, isn't it that when they come to the program, they do get paid every day for participating? Is there a stipend they get to be in the program?
Yes, they work 32 hours and they're paid at the minimum city wage.
Before they graduate? I mean, during the entire time that they're in the program, is there a stipend?
Yes, they're paid weekly. They work 32 hours and they're paid at the city's minimum wage.
Okay. Okay. Thank you.
Thank you.
And the city's minimum wage at this time, I believe, is $14.31. And if we're able to move to $15 an hour, all SOAR participants will receive that same livable wage. Councilman Mundy.
What percentage of folks leaving incarceration are being absorbed into this? And what do we see as the upper end?
Mr. Keller, that question?
Councilmember Mundy, what we would have to do is look at the entire amount of individuals that we're able to record coming out of the system. Mm-hmm. Our data is basically centered around those that enter the program, but we can work toward trying to find you a percentage of those individuals that we're able to estimate that may be coming out of the and include that information as well.
I think that would be useful to know what percentage of that population we're able to impact. And then the other question is, resource is always a question. If we had money in the budget to pay these salaries, do we have jobs to place them? What are our constraints for growth for this program?
Councilmember Mundy, right now, it's basic resources. We have a lot of situations across the city where we these employees. In fact, as they grow, develop new skills, they could actually help us with some of our vacancies that we have in our current operations.
Okay, thank you.
And Councilman Mundy, just for your information, and every class is unique. Sometimes in classes we'll have folks who just come home from incarceration, and then in other classes there are those who are already in the community who are having difficulty finding jobs, and those who just kind of want to work and haven't been quite given that opportunity. So every class looks different, and we'll try to get you that information as soon as we can.
Thank you.
Is there anyone else who wishes to be heard on SOAR? All right,
Mr. Taylor, can I make one suggestion?
Ms. Scipio, please.
I don't know if I was a little distracted with Councilmember Mundy's question, but one thing that I'm always concerned about is how big is the problem and how effective are we in addressing the problem? So I suspect the Justice Department can tell us how many people are released to Winston-Salem. So that would be the market for this particular program, because I think that it should be, we certainly should be able to have more than 8 people a year if there's a large need. But at the same time, I do know that a lot of people who serve their time do return and they find work and they've done well without this program. So part of me is trying to figure out what is the niche we're really trying to address and to resolve. And I would love that in the background of what SOAR is, because that's your mission, trying to tap those who can't move forward for some reason. And I think that's a number that we need to know, so that when you're talking about investing about $23,000 in a person for training and employment, it can balance. Can we use that money to invest with them differently? So I think it's important to just talk about the uniqueness of SOAR versus anything else, and how we make an impact, and why we restrict it to such a small number, if it's just money or if it's something else, and how do we partnership with the Justice Department at the federal and the state level, because there are funds for a lot of things, and how do we tap into it at the city to maximize this program?
Before I go to Mayor Pro Tem Adams, I'll just say optimally, when the program first started, there were not just 8 a year. It was typically we were doing 2 classes a year with 8 to 10 per class. But because of budgetary restraints, COVID, and other situational items, we ended up going with more or less 8 a year. But we're looking to try to move the program forward and ramp it up the best we possibly can. Mayor Pro Tem Adams.
Yes, I'd just like to let the other council members know that for the past probably 10 years, Councilmember Taylor, along with our federal and state advocates that the city taxpayers pay for, that we have been advocating for more grant money through the Department of Justice, through HUD, through Department of Health and Human Services. That's what strategic strategy does at the federal level, and that's what the McGuire Woods people do at the state level. To Councilmember Scipio's point, it would be good, because I did notice on the community giving grant funding report earlier in finance, if you read through that, there are other programs, as Councilmember Taylor knows, that SOAR collaborates and contracts with. But there are also some that, to Councilmember Scipio's point, that would be helpful, that maybe if all of us collaborated together, again, going back to what I said earlier, if we are missing minority businesses to be able to participate, carpenters, plumbers, electricians, if we don't have enough inspectors in planning and development, paying $68,000, $70,000, $80,000 a month, somewhere along the line, folks, and I'm good with everybody in there doing their thing. Like I speak of this all the time to everybody. If all the ants get together, we can lift that elephant. and our people out of this and others, because all of us got 20,000 here, 30,000 there, 40,000 there. We could, as we say, make our little bit of dollars into big dollars and get more done. So I'd like to see, hopefully, the staff of SOAR and Youth Bill and others collaborate with community development, Councilmember Taylor, that we can go get some more out of this. If we had a network bank, as the council member was saying, that if we know 300, and we've known this over the years, if 300-400 people are being released, we should be able to tie in with all of these other nonprofits and agencies that support them, probation officers, the judicial system. And we could probably take that number up to 50 at least, and set a goal every year that we're going to get 50, 50, 50, 50. And in 4 years, we can say we've helped us to save and re-enter 500 people back in our community. But I think it's a great program, both of them. I just want to see us do more collaboration to put some more meat on the bones. Thank you.
I'm coming to you, Councilman Larson. SOAR and Youth Bill, I'll say, has the potential to be one of the biggest poverty reduction programs that we run in the city of Winston-Salem. Being from the neighborhood, my background has been in criminal justice from North Carolina Central University. I've ran the juvenile drug treatment court, and I was a juvenile court counselor for many years. I'll say that being from the neighborhood, there are so many people who have felonies and misdemeanors on their record that can't find adequate employment. And this program has the ability to be one of the biggest lifters of poverty that the city of Winston-Salem can administer. Councilman Larson.
Yes, let me make sure I'm on. Yes, I'm on. I'm a little confused by the graph chart. If we could just go back to that for a minute and maybe get some clarity from that. It appears to me that the total pie constitutes 63 people. And how many years is that over? How many years is that 63 involved?
That number is from 2015.
So approximately 5 years worth of occupancy. And out of that 63, if you were to take that 63 as a pie chart, 49 of those people have completed the program and 14 have not. Is that correct?
Yeah.
Yeah, so those numbers, the percent, I'm not sure where your percentages are working here then. And then if you take the 49 people that have completed the program, out of that 49, 21 were hired by the city and 12 have been hired by the private sector. Is that correct?
Yes.
So if we're looking at the chart, I'm trying to understand what the various sections mean, because right now it's a little confusing for me what the percentages mean. Second question I have, and I think if you look at it in that regard, what you realize is that some 78% of the people that enroll in the program completed. And I think that's a significant number, which is maybe not really reflected in the way this chart is designed, that you have a great percentage, only 23% of the people do not complete the program. And I think that completion rate is a significant accomplishment. Second observation on your presentation deals with the blue bag program. And I'm trying to understand, we're working in 32 hours a week, which is basically 4 days. Are they spending all 4 days picking up trash in Winston-Salem?
Yes, they work Monday through Thursday. They work 7 hours cleaning up trash. And then on Fridays for 4 hours, they receive personal and professional development led by staff and also outside sources. Okay, so they're actually on site 5 days a week, but they're working constricted hours is what you're telling me. They're not picking up trash 8 hours a day for 4 days, basically. Correct. They have a specific schedule and target, pretty much how sanitation works. They're responsible for a specific area, and they have up to 7 hours to complete that project. And they may be called to do special projects as well. So they have to complete that within a 7 hour period. I'm getting a lot of calls in the South Ward about litter pickup. Okay. A lot of concern right now. How are these resources allocated? Maybe that's a Johnny Taylor question.
Councilmember Larson, those particular crews are sent to hotspots that we deal with on a regular basis, but they're also sent to areas when we receive concerns from citizens or council members. So when the Blue Bag program is in place, it would be just a matter of if you had a situation that developed, we would that particular situation into. So they're working.
It's a great program, and I'm totally supportive of that. Combined with Keep Winston-Salem Beautiful and the other programs that we have to keep this city looking good. So I certainly want to thank you for that. The last point I guess I would make, a question I would have is, city can't keep absorbing employment. Right now we're absorbing, based on the chart, 2/3 or so of the people that come out of this program are being hired by the city. And unless we've got a lot of jobs within facilities or sanitation or wherever we are able to place them, there's going to come a time when we really need to get higher placement. If we're graduating 49 people and we're not placing, but whatever it is, 21 in the city and 12, we're placing 33 out of the 49. We're going to run into a problem here where we need better private sector support. And I want to follow up on Councilmember Adams' comment that there are a lot of nonprofits and a lot of organizations out there that maybe we need to be partnering with, not only for funding perhaps this program, but perhaps receiving some encouragement to hire these people after they've completed the city training, because we're not long-term, we can't continue to absorb double the amount of enrollment that we currently are trying to achieve. It's a great program. It's a good opportunity. It's a good gateway to reincorporation into the city, and they can provide valuable services, but we're going to have to find a mechanism to get them employed outside of the city employment.
Thank you, Councilman Larson. And not only do we have to find a way to do that, I think we have to find a way to better fund the program. What I'm hearing based off consensus is that this is a valued program, and we've just got to find a way to put more money in the program. I know we have austere measures in place by the manager and the staff, and we've got to make some decisions come budget time. And I think this should be one of the decisions that we should make. Now, members of the committee, we've got 21 minutes to be within our allotted time for committee work. I'll go with Councilmember Burke, and then I'll come back around to Councilmember Scipio.
I just wanted to say, I think that this is a great program, a great opportunity for our citizens. And I'm going to agree with Councilmember Larson and Mayor Pro Tem Adams. We need to tap into other resources in the community so that other job opportunities become available for our students in this program, possible internships, possible paid internships, job shadowing, training and learning specific skills. Again, we need to do a needs assessment. Where are those job opportunities that need to be filled? And then those are the partnerships that we need to try to develop. Great program. Thank you.
Thank you, Councilmember Burke. Final comments, Councilmember Scipio.
Yeah, there's another number I think that would be important in your overview is to identify what % of your budget is going to staff and administration versus how much is going to the participants for training is one thing, and then the other is the payment that they're getting. Just so we'll know how that financial stream looks. And I really am, I think you really need to look at, talk to probation, North Carolina and federal probation, because I do have 2 family members who are ex-offenders, and they have come out and gotten great jobs with a company that tends to hire these ex-offenders to the point they've gone on and they're buying homes. And I think we have to figure out who are the hard to fit and who are the difficulty. We need people in trades. I think we can get some of these guys to be plumbers and electricians. I'd rather see them training for that as opposed to picking up the trash. We do need the trash pickup, But we really need to fill those other voids that are brick masons that other folks are doing, and so that they can be independent and have better paying jobs. So that's it for me for this. Thank you.
I say plumbers, electricians, brick masons, or city managers. I mean, I think we have such a wide variety of people who can do a wide variety of things. We don't want to limit anybody. I mean, if you've seen some of the classes, we actually have people in finance and other departments throughout the city. So this is a capable group of people, and we'll do what we can to support them going forward. So members of the council and committee, you will get an ask. So be prepared based off of your comments to address the need that we have to be filled in our community. Thank you for everyone who works on SOAR and everybody who presented today. We'll move to item G3. Before we do that, I want to recognize Assistant City Manager Tasha Logan Ford for a comment on G1 that I so hastily moved forward without getting.
Thank you, Chairman Taylor. I just wanted to speak to the time frame for the call analysis project. It lists 18 months there, but I just wanted to make sure that council was aware that that 18-month period, it encompasses the time that it takes for us to do the data analysis, for us to research the different strategies, determine which one might work here for us in Winston-Salem, implement that as a pilot program, and then for us to be able to evaluate the program to determine if that's the model that council feels like is best represents the need in the community. So there are several pieces that encompass that 18-month window, and we'll have some conversations just to understand how our sister cities are moving through that process. But I just didn't want council or our members of the community to walk away thinking that it was going to be 18 months for us just to do the analysis of the calls.
Thank you for that clarity, ma'am.
Yes, sir.
Item G3, please, Madam Clerk.
Item G3, report on the history of the city's efforts to obtain subpoena power for the City of Winston-Salem Citizen Police Review Board.
All right, members of the committee, this is our last item that we discussed with Triad Abolition Project in January. We wanted to move the conversation forward to February. Giving us a little bit of information on this, I know our city attorney is on the call. I'll also recognize Assistant City Manager Tasha Logan Ford for any comments before we move to our city attorney.
Thank you, Chair Taylor. Mayor Pro Tem Adams, members of the committee and council. Item G3 gives a history of requests that the city has made regarding efforts to obtain subpoena power for the Citizens Police Review Board. The card that's before you gives information around when the CPRB was actually created in 1993. And shortly thereafter, the city did put forward a request to the General Assembly to request and to grant subpoena power to the Citizen Police Review Board. So this is something that was on the minds of the council when the board was created, and the request has been made. In addition to the request that was made in 1993, there have been more recent requests before the General Assembly by the city of Charlotte in 17, 18, and also in 1920 sessions of the North Carolina General Assembly. Both of those attempts were not successful. However, we wanted to make sure that council was aware of the efforts that were made and for us to have some conversations as to whether or not the council would like to proceed in making a request on behalf of the city of Winston-Salem again. And with that, I will turn it over to the city attorney if there are any questions that we can answer. So it's not a lot of information that staff has prepared, but really just the history of the attempts that were made. It has been tried. There are other cities that are also engaged in this work and trying to get the same power for their citizen police review boards.
Thank you, Assistant City Manager Ford. Attorney Carmen, as you've heard, I just want you to verify and offer any comments. In order to get subpoena power for the Police Citizens Review Board, it has to be by General Assembly action. Is that correct? And is there any other information you might want to add?
Good afternoon, Chairman Taylor, committee members, and council members. Yes, that is correct. The city does not have the authority or the ability to convey subpoena power to the Citizen Police Review Board. That authority will have to come from the General Assembly. The other thing I would make note of is that there are submission deadlines. In particular, the deadline for submitting bills to legislative drafting is March 3rd. And as you already know, council has adopted its legislative package. So if you're going to add this to that package, you need to act pretty swiftly because of that drafting deadline. And while the deadline is March 3rd for legislative drafting, that assumes that you have members of your delegation who are willing to sponsor the bill. And given what has occurred in the past, we're likely to have a divided delegation with respect to this item. But I think again, it has to go to council to be included and approved by council to be included in the legislative priorities package, and has to go to General Assembly members, to our delegation members in particular, and make it through legislative drafting and filed and so forth. So there's a number of steps that have to be accomplished.
All right, members of the committee and council, the question to be called is simple. Do we want to move forward with asking a delegation member or the General Assembly to allow our Citizen Police Review Board to have subpoena power? Or is this something that we don't want to do and we need it to stay in committee? The reason why we're discussing it is because a group of citizens came to us to consider it, and this is the people's house, and any request, we're going to put it on the table for consideration. Now I'll go to Mayor Pro Tem Adams, and then we'll go to Councilman Larson.
Yes, thank you, Chair Taylor. I was a part of the group Citizens United for Justice in 1993 when we formulated the police and asked the city for the Citizens Police Review Board. That was one of the main things we spent a lot of time talking about in the fellowship hall at Emmanuel. The late Reverend Carlton Eversley, Reverend Mendez, Reverend Churn, Larry Little, Erlene Parman, Larry Wumble, Ms. Hopkins, Maisie Woodruff, Walter Marshall, Vic Johnson, Connie, you could just name the people. It was always a packed meeting, and we met every Tuesday night. Now, when we didn't get that, because we realized how important that piece was for that committee to do its work, we were very, frustrated about it. But Mr. Chair, where I am right now, and the times we are living in right now, the people, part of our responsibility is to listen to the requests of citizens. Citizens look to us to advocate on their behalf and to ask for things on their behalf. And I think it's important that we go ahead. For me, I believe we need to ask our delegation to support this and do like everybody do us, put us on blast, and let the citizens see whether they are for it or against them having this. Because what they're going to find out is what we already know. Voting has consequences. And if they really want to make this go, because the city attorney has just told you who makes this go, then they will need to go work on those 5 people that are at the General Assembly. Thank you.
To the Vice Chair of the committee, Mr. Larson.
Yes, Mr. Chairman. I'm not well enough informed on this matter to know the pros and cons of what's being discussed. I see this as sort of an extrajudiciary activity which has matters of enforcement, subpoena power, who's issuing subpoenas, who does the sheriff department issue those, if they're not complied with, who enforces it, how is this all being handled outside of the normal court system. The system that we have right now of the advisory, Trillion Advisory Police Citizens Committee is designed to act as an advisory mechanism to the city manager for enforcement within the city system. And that may or may not be as perfect as we'd like it to be, apparently, but I'm not sure that I'm ready to endorse establishing a separate judiciary system outside of the city government to try to enforce basically a trial system for enforcing complaints against our police department. So I would recommend we keep it in committee until we can do further study. I'd also like to hear from the other cities as to how they're constructing their review process within this process. I think there's more work to be done before we're ready to vote on this. Right now, we're forcing it on a fairly tight schedule to get it in front of the legislature by the deadline in March. And I would like more time basically to study on it.
All right, thank you, Councilman Larson. I'm going to go to some of the committee members and I'll work my way back around, but I will say it's my understanding that this request is not for police, or what I'm going to say, personnel records, medical records, or for body cam footage. So this would just be subpoena power outside of those 3 elements. Councilmember Mundy.
You mentioned one of the things I wanted to mention, and that is I didn't know this until the board, that the body camera footage, it has to have a subpoena, that we cannot release that, the police department cannot release that. I don't think the general public is always aware of that. But then the other thing I would like to ask Attorney Carmen is there a downside to this? I'm like Councilmember Wilson, I don't know the pros and cons, but if there is a downside, what is that downside?
Let me, if I may, Chairman Taylor.
Attorney Carmen is recognized.
Okay. One correction. The body worn camera footage can only be released with a court order. There are certain individuals in the statute that have access to it, but outside of those limited number of individuals, it can only be released by a court order. In terms of the subpoena power, yes, you're correct. There are pros and cons. And one of the things I think in terms of a potential con is mentioned to some degree in the information item. The subpoena power, which as drafted would give the Citizen Police Review Board the ability to issue a subpoena. And if a person does not respond or does not appear, then in theory, my office would have to go to court on behalf of the Citizen Police Review Board to enforce the subpoena. But one of the downsides right now is that a subpoena, if that authority was given, would not include the body-worn camera information or the footage. And most often, that footage is the best evidence of what transpired. With the subpoena and potentially a witness appearing, and all of this would be in closed session because they review essentially personnel matters. But even with the subpoena and having someone appear pursuant to that subpoena, most often it's going to be one person's word versus another person's word, which is why I think the body-worn camera footage in most cases is the best evidence of what transpired. And the only other thing I would add is that given the history of this particular request in the General Assembly, it doesn't appear that the appetite, at least for as the members of the General Assembly, is such that it's likely to pass. But I guess if you don't ask, you don't know for sure.
And I'll add for the record, the ability to see the body cam footage, the inability to see the body cam footage is not something that the City Council decided ourselves. That was by legislation from the General Assembly. Councilwoman Burke.
I'm in support of the subpoena power request.
All right, members of the committee, we've got 6 minutes left to stay within our allotted time. Councilmember Sipper, I see you, just give me one moment. Madam Attorney, just for the record, I've heard from 3 members of the committee. How many votes does it take to get an item like this out of committee to move forward to the full council for consideration?
You need a majority of the committee members to support it to move it towards council.
And if the item is split 2-2, it stays in committee, correct?
Typically, that's what happens.
Well, before I move to Councilwoman Scipio, I will say I am in favor of listening to the request of Tri-Abolition Project. And it sounds like there might be 2 votes in favor and 2 votes in dissent. So,
hey, this is Nia from the Forsyth County.
But Nia, if you don't mind, I'm gonna ask you to hold up, and I promise I'm gonna try to get back around to you in just one moment. So let's go to Councilmember Mundy, then Councilmember Scipio, because he's on the committee.
Are you thinking that I would be a no, Chairman Taylor?
Well, based on what I heard, I assumed that you would be a no, but you know what happens when we make assumptions, so please forgive me if that's not the case.
It's not, but I wanted to hear from Attorney Carmen if there was a downside that we could, the city council or the city of Winston-Salem could suffer political consequences. I'm willing to take that risk, given what the council or what the attorney told us. So I don't think I'm necessarily going to be a no on this.
Forgive me for making that insinuation. All right. We've got 4 minutes, Councilmember Scipio, then we've got someone who asked to be heard on the Mayor Pro Tem. Now, if we go over, y'all don't get mad at me. I'm trying to reel this thing in and get this moving now. Councilmember Scipio. You're on mute, ma'am.
thank you. Mr. Chairman and committee members, one of the things I've learned in my life is that timing is everything, and there's a season for everything. Because it hasn't happened since the 1990s, and it's failed numerous times, is no reason that you don't continue to try. We don't really know what our representatives would do, but I think this is very important, that we should have this kind of tool in our toolkits. And so I would say bring it to the council and let us vote up or down whether it goes to the state. It's no harm in doing that. And then if the season is right and our state legislators can get on board, then I think it can be pushed through. But if we do nothing, we're just saying, okay, let's just wait another year. And then we're going to wait another year. And it's going to sit. Sometimes things don't happen because we've forgotten what it is we're really trying to achieve. And we need all kinds of tools in the toolkits for our citizens who review our public safety officers to have to do a great assessment that's not biased and not tainted, but it's based on facts. So I would like to encourage the committee members to vote yes, to get it to the council on Monday.
Time is short on our ability to make this decision, and it's short on our meeting tonight. So Mayor Pro Tem Adams, you got the floor.
I know. All I want to say too is Attorney Carmen, please go back and Ms. Logan Ford, go get the history as to why the community, the Citizens Police Review Board came into being in Winston-Salem. I think a lot of people don't even know what was transpiring then is what's transpiring now in our communities all over the country. So please go do the history, because that's why we came together, the Black leaders and folks in Winston, because there had been some issues. And this is not to taint the process, Chair Taylor, but you need to understand where the Police Review Board was conceived and why it was created. Thank you.
Okay, we'll move to call the question. Nia Saller asked to be recognized for some comments.
Yay, thank you. Okay, so I'm with the Forsyth County Police Accountability and Reallocation Coalition. That's our group, and we're asking, like, yes, subpoena power is helpful, but we're actually asking for an independent CRB, because right now it's not, because of the conflict of interest with Lee Garrity. So we're like, yes, this is good, but we're asking for a completely different entity, in that the people on the board are elected by residents, not appointed by the mayor and city council. So yes, but also no. And we understand that Charlotte failed as well, but in getting subpoena power, but we're asking for a complete upheaval of what our community review board looks like right now. So it's both, and both realities are true.
Ms. Sadler, thank you for your comments. I do agree that the Citizen Police Review Board should be looked at in several different parts. The part we're discussing today is just simply subpoena power, and I want to make sure I get this clear. Are you guys not asking for us to do that, or are you asking for us to move forward with consideration at this time? That'd be important to know.
We're asking to keep it in committee, so don't necessarily vote on it right now. But consider the fact that we're asking for a completely different entity. So I think researching the history right now is a good start, but also another way and doing the CRB would be 100% what we asked for.
So as you heard from our city attorney, I think this information has to get to them for their consideration by beginning of March, I think March 3. So if we hold this in committee, then we run the risk of having to look at this again next year. Madam Attorney, did I get that correct?
Well, actually, it needs to get to the delegation before then, because they have to get it to legislative drafting by March 3rd.
All right, and simply, we are hearing this and doing this because we were asked to consider it. Now, if you want us to hold it in committee on your behalf, we're happy to do it, but it sounds like there is support to move this forward. So I'll go again to Ms. Sadler If you want us to hold it in committee for further consideration to look at other parts of the Police Citizen Review Board, we can do it, but just let us know how you guys would like us to move because we're doing this at your behest.
Mr. Chairman, point of order.
Vice Chair is recognized.
Yes, I would make a motion that we hold this in committee. I just think I think the citizen input is important. I think we're going to evaluate the whole concept of the Police Review Board and how it functions. There's too many loose ends right now for me to feel comfortable about moving this forward. So I would make a motion that we hold it in committee. If we lose a year on it, who knows whether it's going to get through the legislature anyway. We get a better handle on what's going to happen in the legislature. We got other cities that are trying to do it. If they can get it through, then we can get it through as well. But right now, I think that we do better to get our house in order first.
Is there a second?
I'll second.
All right, it's been seconded. Is there discussion? We've got a motion on the floor, we got a second, now we move to discussion.
My only discussion point is changing the Citizens Review Board completely versus taking what we have now and adding subpoena power. Those are two very drastic differences. So I think if we're going to change more than that, I need more time. I don't know enough to make any kind of a good decision and feel good about it.
All right, no, if there's no further discussion, there is a motion and a second to hold this item in committee. We'll go down the roll so that everybody can be heard equally. Councilman Larson.
Yes, please.
Councilman Mundy.
Yes.
Councilwoman Burke.
No.
And wowzers, we've never been in this situation. I would say I am willing to move it forward, but if hearing from the citizens who made the request, if they aren't willing to move it forward and they want to hold it in committee at their request, I will hold this in committee for further consideration.
Chair Taylor, this is Celine Johnson. May I ask a clarifying question?
Ms. Johnson.
Thank you. My question is, are these mutually exclusive? If we go to the legislature now to ask for subpoena power for a committee, is there any reason that subpoena power, like, is it only with that committee or would it be with, does anyone understand my question? Or Ms. Carmen, it looks like you're able to answer.
Attorney Carmen?
Yes. What the committee and ultimately if the council approves the request would be sending to the General Assembly is to give the current Citizen Police Review Board as presently comprised subpoena power. Not an independent board, but the current Citizen Police Review Board as it is presently comprised and composed. That is a separate issue.
Just as a point of order, it looks like it's 3-1 to hold this item in committee. And so we'll do that. And if there's further consideration that needs to be had in March, we're happy to have that conversation, but we were up against a deadline. Before we move to adjourn, I will do this as I always do at the beginning of the meeting. I want to take a moment and thank our police department, our fire department, and our emergency management departments for the work that you do to keep our citizens safe. We love you. We appreciate you. To the committee, it's been a very detailed discussion. To the members of the community who came and offered their input, thank you. We'll move to adjourn this meeting. There's no further business for the good of the order. Consider this meeting to be adjourned. Thank you.
Thank you.